Hi everyone. In our previous videos, we have seen how diabetes is not about just rise in your blood sugar, but how it affects various organs in our body, which are the kidneys, the heart, the brain, the eyes. And today we are going to ask Dr. Sailesh Bandotkar, consultant general surgeon at Vision Hospital Mapsa, about how diabetes affects the foot of the person.
So, doctor, uh, diabetes basically targets your blood vessels. By targeting your blood vessels, it causes something called as a vasculopathy. This leads to neuropathy, which leads to all the problems in a diabetic foot patient. Now we see these patients because of neuropathy getting small cuts, which predisposes them to infection. Infection leads to amputation and gangrene. All this can be prevented by taking a few simple steps can be taken to take care of this.
Okay. So what care should a person with diabetes take to prevent any problems to his foot?
There are few simple things that the person can do. It's very easy. Every night before going to sleep, inspect your feet or have somebody to inspect them for you. See for any cuts, blisters, ulcerations, any redness, any discharging wound, any foul smelling discharge, any penetrating injury in your foot. Always wash your feet regularly with lukewarm water and a mild soap. Dry them thoroughly, apply a moisturizer but not between the toes to prevent fungal infection. Do not treat corns and callosities on your own with over-the-counter medicines like corn files and corn caps, which can again lead to ulcerations and infections. Take care of your nails by cutting them straight across. Do not go very close to the nail folds, otherwise ingrowing nail will occur. If the nails are thick, you have to see a podiatrist to cut the same. Do not attempt to cut a thick nail. Footwear is very important in diabetics. Wear a comfortable footwear which is neither loose nor tight. See that you do not walk barefoot even at your home. Footwear should be worn every time you are walking. You cannot walk barefoot. That is very, very important in a diabetic foot. Wear the footwear which is comfortable and neither loose, again as I said, neither loose nor tight. It should have a broad toe box and avoid high heels. Wear a socks when you are wearing the footwear, and it should be a diabetic socks which is seamless socks which prevents callosities.
Okay. So if a person with diabetes has a small cut on his foot, what he should do? Should he wait and treat it himself or come to the doctor?
Ideally, any cuts should be seen by a doctor because the patient's sugar may not be controlled, and always it's a small cut which will lead to big problems, which I always tell my patients. So if you have a cut and your sugar is controlled, you may observe it for a day preferably, but see a doctor. If you find that the cut is discharging, if you have increased redness in your foot, increased warmth, fever, see a doctor urgently. Do not wait till the next morning.
So what message would you like to give about the foot care in diabetes?
So take care of your feet with the simple things which I have told you. Control your blood sugar levels, avoid smoking, avoid alcohol, and see a doctor if you find any of the things which I have mentioned, namely an ulcer which is discharging, increased warmth and redness in your feet, any foul smelling discharge coming out, and any fever.
Thank you, doctor.